pediatric hematology. Again, 3 components that are present in the blood, should not be new. Okay, and so we were saying things vary, such as age, gender, and altitude. All right, so like for example, if I live in Denver, I might have more red blood cells, right? Why?
Because oxygen.
Correct, the circulating oxygen. So the body physiologically compensates for that, right? By increasing the red blood cells to capture, because there's less oxygen that's circulating to allow for more capturing. So the increased need for oxygen in utero accounts for a higher red blood cell count in infants actually. They have much higher red blood cell counts, and the blood cells have a shorter lifespan. Okay, what's the average lifespan of a red blood cell?
120 days.
I was going to say somewhere between 90 to 120 days, exactly. So they actually have a little bit longer. Neonates, the first month, they have a shortened, that's supposed to be RBC lifespan, actually. And after 5 years, red blood cell production in the long bones decreases. Okay, a lot of the red blood cell production is in the long bones in the first 5 years of life, but they're also growing quite a lot. And they're more porous, the long bones. Let's talk for a minute about lead poisoning. Who knows anything about this? Or will put children at risk? Or what it does to their body? So Stephanie says certain toys, okay, if they're not manufactured up to par because of the metals or because of the paint even that's used on them, and then children put them in their mouth, and if there's a lead-based paint that's used, if it's a toy from another country that was not manufactured to par, or if there's a metal there and they're putting, even certain clay pottery, old buildings, older than the 1970s, that have paint that's been put over and put over and put over the paint, so that now if it chips away in the corner or by a windowsill, and the child, very hand to mouth, movements are common, then they can actually raise their lead levels. You were going to say something.
Besides the chipping, raising the windows, like if you have old windows, they go up and down, you get the dust. And then if they touch it, put it in their mouth.
Or even inhale it.
Yeah.
Right, because lead can be taken in through the digestive system, the respiratory tract, okay?
Just up blood.
Yeah, that's where it goes, and then it goes into the blood. And lead binds with hemoglobin, or with the heme, the iron. So it does not allow for the hemoglobin to be able to grab oxygen as effectively, which creates an anemia, okay? Because it competes there and does not allow the oxygen to be, so then you have an anemia that occurs. So why do the adults in the household or the older children in the household don't have this problem, but the toddlers or the younger children in the house have this problem?
Because we don't eat paint.
Well, some do, if you have pica, right? We talked about pregnant women. Even older children can sometimes, eat things, put things in their mouth they're not supposed to. And some people work in areas with lead even. And they do. If you really work with high levels of lead, you can actually get lead poisoning as an adult. It's not impossible. But what Ina says is part of the answer to that too. And she says that what happens with children is that they have immature functioning systems at this point. The kidneys are what excrete lead. They go through the blood and they help to excrete it. And the kidneys in young children are not, I'm talking preschool age and younger, are not able to filter out the lead as effectively as it is for adults. Now an adult can get lead poisoning if they have high exposure to lead. I'm not just talking little paint chips or breathing in stuff, but if you're actually working in an area that uses lead in a factory consistently and you don't wear some kind of special mask to filter that, you will end up, adults have ended up with headaches. There's a great video in the lab and even online through UCC's library that talks about adults have had headaches. They've had kidney problems, they've had bleeding issues, they've been tired and fatigued, with other problems concentrating because they work with very high levels of lead. And so it's not to say that it can't affect adults either, it just affects children, preschool age and younger quicker because they do put things in their mouth more frequently. They're exploring their area, especially toddlers as they become mobile. And because their kidneys can't excrete it, takes very little for them to become overloaded with it and then it stays. And it also deposits in the fat tissues. So after besides competing and not allowing the iron to form and therefore hold the oxygen, what it also does too is it sits in these fat cells and will be excreted slowly over time and can be released again so that you can have more lead issues too down the road. So what are the signs and symptoms? Well, usually, again, it is children who are mobile. They first start to check it. In the state of New Jersey, mandatory screening is at a year of age. They check lead levels on children. And when they check these lead levels, they're looking for anything over 10, which is considered positive in the blood. Other things and signs and symptoms that they would have a positive lead level are what? Anybody know? What were some of the other signs and symptoms that there might be a lead poisoning issue in children, young children? Not so much the eating right away. What you see more so is problems with attention. What a lot of people complain of is almost like an ADHD that they think the child is developing. They said they can't sit, they can't concentrate, they can't focus. Many times children become misdiagnosed with ADHD when they truly have lead poisoning. Okay, because when you look at them, they're very hyperactive compared to their counterparts. That's when you have consistently low levels. If the level is high enough, it will cross the blood-brain barrier, and you can have seizures and other issues. That's when you're talking about levels of 70 and higher. So that's why you do not want to let it go. It is preventable, can be inhaled or ingested, and the highest incidence, again, is when the child becomes mobile and starts putting things in their mouth. So household dust, soil, drinking water even, depending on your system in your house, if you have older lead pipes. Unglazed ceramic containers, furniture refinishing even, and highway construction. If you live by highway construction, they still do use a lot of lead if it's like a bridge, many times. And then obviously, they say 1974 is when they passed the law that really stopped all of the lead, but even before that, people were becoming more and more proactive. So they said definitely homes earlier than 1960 are going to have lead in them, especially in the pipe strip, unless it's been abated. And an abatement, A-B-A-T-E-M-E-N-T, which it's in there later, an abatement of the environment means somebody literally goes in, and it's tens of thousands of dollars. I mean, you're talking a lot of money, where they go in and they wear these suits and they actually stripped the whole place, and then they go in, they change all, and they take all the lead out. But it costs a lot of money. And many times the people who live in these homes, that are older homes, that are more run down, that have these issues, either are renting, and it is not required for somebody who owns a place to do this. So that means they have to find a new place to go live. We had a case at North Beth Israel where there was a young girl who was there, who had been misdiagnosed with ADHD, who actually had lead poisoning, and she was waiting at the hospital until her family could find a new home to go to, a new apartment, because the apartment building she was in had lead in it. And they didn't want to let her go back to that facility, so they were looking for somewhere else to live, and a person, a landlord, an owner of a home does not have to go through the abatement process. Now, if it's government housing, that has to be lead-free, but private housing does not. And it's thousands of dollars, so most people will not go through that process.
Although once a landlord has reports of verified lead, they do have to disclose it.
That's right.
So,
You have to disclose it when you sell your house, you're right.
if you have actual reports. If you don't have reports,
Yes.
it's in there, you know
You
it's
should
in
say
there, you just
unknown.
say no knowledge. You give them a lead paint book and
That's right.
you know it's there.
Melissa is saying that if you're selling a house, it goes the same way too. If you're selling a house or if you're renting a house, you have actual documentation that there was lead in the house, you have to supply that to people. You don't have to, again, you have to go through the abatement process. They can't force you, but you have to let people know who are prospective tenants or prospective buyers of your home. That's right. Okay, so the pathology is, again, it gets either inhaled through the lungs or absorbed through the GI tract. It's usually excreted by the GI tract and the kidneys, but again, children have immature systems. So very easily it builds up in their systems where it wouldn't for adults in lower doses. And again, it attaches to red blood cells, allows less oxygen to be consumed by the red blood cell, therefore leading to an anemic state, developmental delays, anxiety in the child, irritability, inability to focus, because again, they're not getting the oxygenation they need. And that's what this goes into again. So again, it enters the CNS. In early stages, it just causes those mild symptoms I spoke about: hyperactivity, impulsiveness, aggression even, lethargy, and shortened attention span. In high doses, though, it can actually cause seizures and other very large neurological problems. And it does alter the permeability, so it does shift fluids, which can actually cause problems in the brain and increase ICP, because as it starts to cross that blood-brain barrier, you know what I mean by that, right? It goes out of the blood and into the CSF. It actually causes a higher concentration, and therefore you have a shift of fluids outside of the brain tissue itself and into the CSF too, which increases the ICP of the brain. Making sense so far, right? You're following? And therefore, you can have increased ICP, which leads to the seizures I was talking about, can lead to permanent brain damage even, and shifting of the brain. So this is what we want to avoid. This is like the worst case scenario of lead poisoning that's out of control, which you might think, well, how could that be? It doesn't take much for a small child. You're talking 2 or 3-year-old, they're eating lead paint, you know, lead chips and stuff, that's enough to cause these kind of problems. So that's why we want to recognize it. It is something that's done yearly, like yearly checks by the pediatrician, but obviously if there's reason to believe that they are having some symptoms earlier, then they would check for that. Okay, so which children are more vulnerable? Those who put everything in their mouth, and you know some children are more likely to do this than others. Immature body systems put them at risk, and they have a proportionally greater lung space to body weight, so they are, if they're inhaling it too, it's coming in easier. And we see things like anemia. Pica puts them higher risk. Anorexia goes back to what you were saying over time, Pascal. They will have a decreased appetite, crampy abdominal pain, delayed growth and development, and neurological changes. Go ahead.
It has pica as a manifestation. Is that they would already have pica, so they'd be more inclined to eat them?
Actually, it works. Pica keeps them in a cycle. Initially, you know, pica is almost like a common developmental thing for young children because they explore with their mouths. So they start off having that. But then, as your body has less iron, and other deficiencies, exactly, vitamin deficiencies, and you're not getting, people actually, that's why they say some of the pica is actually almost physiologically drawn. And you'll talk more about pica next semester in 232, but they start to have like a desire to want to eat these inanimate things, like metal objects especially, when there's lower iron circulating, which there would be in this case. They actually start to put more metal objects, and something in the taste of it is what it draws them to actually more inanimate objects. Does that make sense in a weird way? I'm not the, you know, pica expert, but I just know that it is something when somebody starts off with inanimate objects, and they actually, and that's why women who are pregnant sometimes get pica when they don't do that normally their whole lives. They say it's because they have these vitamin deficiencies, their body is drawing more, and they want to put things in their mouth, and it actually enhances it because of these mineral and vitamin deficiencies. So to answer your question, pica puts them more at risk, but it is also a clinical manifestation. They're more likely to put things in their mouth when they have this too, because they have these mineral deficiencies, making them gravitate toward it. I'm going to have you stop for a minute, Enya.